But Michael, from your perspective, the average American, beyond how they voted or if they asked their lawmaker to repeal, and that was a campaign promise, from a health care perspective, I'm a mother of 3 kids. I don't care what it's called. I want my kids to get the best health care, and I want to afford it. How does repeal only work for the American person?
It doesn't. I mean, if you repeal only, and I think Ali did a great job talking about the CBO numbers there.
I do too. Congratulations.
Yeah. You know, if you repeal only, the insurance markets will explode. Insurance companies will pull out. One thing that insurance companies hate is uncertainty. They hate uncertainty. So if you tell them that you're going to repeal this law, that the individual mandate's gone, that the subsidies are gone, that the Medicaid expansion is gone, but just wait a couple of years because we're going to come up with another idea to fix it all, they're going to say forget about it.
Ali, that uncertainty is exactly the sentiment we heard from a different kind of CEO, Jamie Dimon, on Friday. When insurance companies, when banks, when any industry doesn't know what's in store, when they can't protect their bottom line, when they can't plan for it, they're stuck. So they're saying, what's the clear path? So it's so bizarre to say, let's just repeal, and we're going to figure it out later. Why?
And Michael, what are the options beyond just repealing and delaying for 2 years that make sense to you at this point?
Right. Well, the option that makes sense, I think, at this point is for the Republicans to try to work with the Democrats to try to stabilize the insurance markets, perhaps guarantee the cost-sharing subsidies that we've been talking about over the last
and let's just tell our viewers what that is, because that gets missed in this discussion. Under Obamacare, these insurance companies that don't like uncertainty said, we're not sure how this is all going to shake down. So they made a deal, the federal government made a deal in which they are subsidized to some degree to basically deal with the shocks to their system.
Right. I mean, for relatively low-income folks who are on the exchanges, there's $7 billion a year worth of subsidies to the insurance companies to pay for the cost sharing that those people have. Now, there was a federal court which raised a question as to whether or not there was money appropriated for that $7 billion. And so the Trump administration has been trying to decide whether or not they're going to keep paying those cost-sharing subsidies or just drop the subsidies.
And
now,
that has resulted to some degree in the insurance premiums going up because the insurance companies are preparing for the idea that they may not get them.
100%. And one option, one thing that could happen, you know, last night President Trump tweeted, you know, let's try the whole repeal and delay. Today he's tweeting and saying, you know what, let's just let the whole marketplace fail and then we'll come in and fix it. Well, you know, if the administration decides that they're not, if they're going to cut off those cost-sharing subsidies, they don't have to wait for Congress.
It will fail.
But if it's, let's let this thing fail, how does that help this administration to say, well, it still doesn't have our name on it, it only has Obamacare? People voted for change. If this happens on the president's watch, he owns it. Republicans control everything. So it's his base who, if they lose their health care, are they really going to stand behind the president?
I agree. I mean, I think you have it exactly right, except I'm not sure he agrees with you on that. And who knows exactly what his base is going to think as this thing plays out. But I think you're right. I think you're completely accurate there.
Michael, thanks for being with us. Michael Speier is the chair and professor of public health policy and management at Columbia University's Mailman School of Public Health.